Hi, Assalamualaikum and a very good afternoon. Thank you all for tuning in to our Facebook Live today. My name is Dr. Azura Deniel. I'm a clinical oncologist at 𝗙𝗵𝗃𝗄𝗃 Specialist Hospital, and today I will be sharing about women cancer. So before we start our session today, I would appreciate if you can share this to your Facebook so that many others will also benefit from our sharing session today. And this will be an interactive session, so you can feel free to ask me any question. I will try to answer them at the end of this session. So we celebrated International Women's Day yesterday, and in conjunction with that, that's why I'm talking about women cancer. I specialize in the treatment of cancer patients, which means that I do mostly chemotherapy, radiotherapy, and also other types of treatment, including hormonotherapy, immunotherapy, targeted therapy. And I want to start with sharing with you about uh, the differences in cancers in women compared to men. So this is the statistics from our latest cancer registry. And you can see on the left-hand side are cancers in women, and the right-hand side are cancers for men. So if you can read, the most common cancer in women starts with breast cancer. That is the most common, compared to colorectal cancer as the second most common, followed by cervical cancer, lung cancer, ovarian cancer. And also next is corpus uteri, is cancer of the uterus atau cancer rahim. And then thyroid, leukemia, and other skin cancers. If we compare that to men, the types of cancers that men get are mostly number one, colorectal cancer, followed by lung cancer, prostate cancer, lymphoma, nasopharyngeal cancer, liver cancer, leukemia, stomach, other skin cancers, and bladder cancers. So if you look at the types of cancers that we get, what women get is mostly related to organs that is specific to women, which are breast, cervix atau cancer pangkal rahim, and then you have ovary, cancer ovary, dan also cancer rahim sendiri. So these are specific to us, and men cancers get different types of cancers. So in total, it was reported that there were about 63,000 cases in women and about 51,000 cases in men over a period of 5 years in the latest report. So women may think that men get more cancers, but actually women do get more cancers compared to men. And if we look at the risk of getting cancer, women has a slightly higher risk of getting cancer compared to men, where the risk of getting cancer in females is estimated to be 1 in 9, whereas in men is estimated to be 1 in 10. So adalah dianggarkan yang jumlah risiko perempuan untuk mendapat kanser adalah lebih tinggi daripada lelaki. Dari setiap 9 orang perempuan, mungkin seorang berisiko mendapat kanser, manakala untuk lelaki, setiap 10 orang mungkin seorang boleh mendapat kanser. Jadi, these are the 5 main types of cancers in women. To recap, breast cancer number 1, colon cancer is number 2, cancer of cervix is number 3, lung cancer, and then ovarian cancer. These are the 5 main types of cancer. So this is a question that I get all the time in my clinic. Why does the cancer develop? It's a very difficult question, and all I can say is that it's a complex interaction between our genes, and also our genes means it's internal, that is related to our own body, and also it's related to external factors. It's like environment, lifestyle, and finally there is also the element of chance. So even if you have everything the same, there's still the element of chance where randomly anybody can get cancer. So the first thing that I want to talk about today is to get all the women out there to empower yourself to know a bit more about cancer, know about the risk of cancer and what we should do about it. First point is you should know what is your cancer risk. Well, the risk of cancer, as I mentioned just now, is related to internal and external factors. So age is one of the internal factors that we cannot control. If you look at this graph, you can see that pink is females and then blue is males. So the risk of getting cancer actually increases for females at about 30 years old. And then it starts to rise, and if at 40 years old the risk is higher, and it goes up as you grow older. And if you can see, the graph actually is a bit different from men. Men actually gets the risk a little bit later than us, and their risk actually increases more than us when it's about 60, 70 years old. So we have to be more aware that as we grow older, especially when we reach the age of 35 to 40 years old, then we should be more aware and start to do something to try to reduce our risk, or start to go for medical checkups so that we can detect any changes in the body early. Second factor is family history. So family history means that if you have anybody close with blood relation to you that has any cancers, first degree relatives or second degree relatives, then you are at higher risk of getting cancer. But actually, family history only accounts for about 15 to 20% of the total number of cancers, and about 80% is actually related to external factors and not really hereditary. On this graph, this actually shows an example of a genetic mutation, which is the BRCA mutation, which was viral, I think, many years ago, about how Angelina Jolie detected that she had BRCA mutation. She didn't have cancer, but if you have the BRCA mutation, then your risk of getting cancer increases significantly, especially breast cancer, ovarian cancer. So those who are known to have this type of mutation should go for earlier screening, maybe at the age of 35, and more intensive screening. Let's go on to external factors. So lifestyle risk is something that is modifiable, something that we can do something about. So it was reported by WHO that about 1/3, 30% of cancer deaths are associated with these 5 lifestyle risks. Number one, it's high body mass index, or overweight or being obese. So people who are overweight or obese actually have a higher risk of getting cancer. Unhealthy diet. So unhealthy diet is mostly diet that has low fruits and vegetables, diet with high fat. This type of diet actually increases our risk of cancer. Lack of physical activity, where we don't move about so much, mostly, especially during PKP now, most people are confined at home. We need to do something to reduce this lack of physical activity. By right, we should target about 10,000 steps a day. And I'm sure everybody has handphones now, and you can actually monitor how many steps you take a day. So make the effort to try and reach up to 10,000 steps a day. You can just walk around the house if you can't go any further than that. And of course, smoking and alcohol definitely increases the risk of getting diseases, including cancer. And we probably could do something about it, try to reduce or try to stop. Let's go on to specific risk factors for breast cancer. This is a list of risk factors for breast cancer. Number one is family history or first degree relative having cancer. Number two, early menarche or getting your period early, dapat menses awal. Number three, late menopause. Number four, late pregnancy. And number five, nulliparity. Nulliparity means that you've never given birth before or never been pregnant before. This all is related to exposure to estrogen in the body. And number six is people who had history of breast diseases before should get monitored to detect any risk of cancer development. And we look at risk factor for cervical cancer. So actually, cervical cancer is mostly related to HPV infection. That's what we know now. So the list below that are related to increased exposure to HPV. That includes people who have multiple sexual partners, early sexual intercourse, first delivery before the age of 17, high parity where you actually delivered more. These are all related to HPV infection, and we can do something about it. I will talk about vaccination later. Prolonged use of contraceptive pills more than 10 years is also related to increased risk for cervical cancer. Smoking and also people with weakened immune system have a higher risk. If we look at colorectal cancer, the first top 5 is actually related to lifestyle. So these are the 5 main factors that I mentioned just now. Unhealthy diet, smoking, alcohol, sedentary lifestyle, obesity. So these are things that we can do something about. By modifying all this, we can reduce our risk from getting colorectal cancer. The next one is family history, and also those who has any history of polyps should also be monitored so that any changes can be detected early. Lung cancer is mostly related to smoking. So smoking actually increases the risk. Heavy smokers can be up to 24% for males and 18% for females. And if you stop smoking, actually, you do reduce the risk of getting lung cancer. Other factors include industrial exposure or lung diseases. Either you get chronic infection or chronic scarring in the lung. So those are the risk factors, and we should be more aware. We should know if we are at high risk, then we should seek attention. The next thing I want to talk about is to seek medical advice early. This means that if you have any symptoms that is new, you should see a doctor or seek medical advice so that any diseases or any cancers can be detected early so that we can treat it early with a higher chance of cure. These are the symptoms of cancer that we should look out for. So in general, any new lumps or bumps in the body should be causing an alarm to us, especially if it occurs in the breast, abdomen, any benjolan lah, I would say benjolan or ketulan, terutamanya di payudara ataupun di tempat-tempat lain tu, termasuk perut ataupun di mana-mana di badan, perlu mendapat medical attention, kena pergi buat medical check-up. Any abdominal bleeding. So abnormal bleeding can be from the vagina, where you can get bleeding in between periods, or you can get bleeding after you have had menopause. So for patients or for people who've already achieved menopause, any bleeding after that should alarm the person. Any other bleeding like from the rectum, from the nose, or blood in the sputum should also ring an alarm bell for us. Any changes in bowel habit is also a significant symptom. Unintentional loss of weight or loss of appetite. So sometimes people do lose weight because they try to be more healthy and try to reduce their weight. That's okay. But if suddenly, without them doing any intervention, they lose a significant amount of weight, maybe more than 5 kilos, more than 10 kilos, then that should actually ring an alarm bell as well. Any persistent symptoms like cough, persistent cough that doesn't go away, that lasts for months, any hoarseness of voice that doesn't go away, or any ulcer in the body and the mouth or anywhere else, especially in the legs, should also cause an alarm and should get medical attention. So if we look at specific symptoms for each type of cancer, if we look at breast cancer symptoms, usually it will present as a breast lump. So breast lump can be small. Most of the time it's not painful. And apart from lump in the breast, you can also get swelling in the axilla. So bengkak di payudara ataupun bengkak di ketiak. Ini adalah dua simptom yang utama untuk kanser payudara. Ataupun any abnormal shape of the breast. For example, in the picture below, you can see that the shape is a bit distorted. That is also a symptom of breast cancer. Any changes in the skin, like the picture above, it can be infection, but it should also be checked out in case it's cancer. And any changes around the nipple or nipple inversion should cause an alarm as well. Symptoms of cervical cancer. Cervical cancer actually most of the time at the early stage is asymptomatic. So there's no symptoms, there's no pain. But at the later stage, maybe it can cause bleeding, like I mentioned before, bleeding after menopause, or it can cause persistent discharge from the vagina. It can cause post-coital bleeding, where you get bleeding after sexual intercourse, or it can also cause pain. So this is something that we should look out for. Colon cancer symptoms, changes in bowel habit. So this is called altered bowel habit, where what it means is that if you usually go in the morning, but after that it changes to being more constipation and then diarrhea. So you get like a cycle of constipation and diarrhea over a period of time. That means that your bowel habit has changed. So that is something that is not normal and should be checked out. Any bleeding from the rectum, anemia, low hemoglobin ataupun tak cukup darah, abdominal pain, intestinal obstruction macam usus tersumbat. So that may cause vomiting, abdominal distension, perut jadi kembung dan tak boleh buang air besar. So those are symptoms of intestinal obstruction. Any weight loss, severe weight loss. For example, the gambar, the picture above, that is one of the symptoms of colon cancer. Lung cancer symptoms include cough, persistent cough that doesn't go away. Sometimes it can cause difficulty breathing, sesak nafas, blood in the sputum, chest pain, hoarseness of voice, loss of appetite and loss of weight. These are all symptoms of lung cancer. However, if these symptoms actually appear most of the time, it means that the lung cancer has actually is actually more advanced, because early stage lung cancer usually doesn't cause any symptoms. So how do we detect cancers before it's actually grown to be bigger? How do we detect it early? If possible, we want to detect cancer before it becomes cancerous, or what we call the pre-cancerous stage. So actually all these types of cancers that I mentioned can be screened. By doing screening, actually we can detect the cancer early, treat the disease before it becomes cancerous, and therefore prevent cancer. Or by doing screening, we can also detect the cancer early, have treatment early, and have a higher chance of cure. So types of cancer that can be screened. Number one is mammogram. We can screen breast cancer by doing mammograms. Mammogram is like an X-ray of the breast, where any changes can be detected earlier than before it can be felt. So sebelum dia menjadi bengkak, actually there are some changes yang we tak boleh rasa. Tapi bila kita buat mammogram, kita boleh jumpa dia perubahan. Itu awal dan boleh buat sesuatu sebelum dia menjadi kanser. So screening mammogram is recommended for people who are at least 40 years old, and it should be done at least 2 yearly for people with average risk. But those with high risk, they should undergo screening earlier. Screening for cervical cancer. So screening for cervical cancer is where we take a sample from the surface of the cervix. And by doing that, we look at the cells and detect any precancerous changes. And this can also be treated before it becomes cancer itself. Or if we detect early, we can actually cure the cancer by doing treatment early. So cervical cancer screening is recommended at the age of around 20s. And actually, there's also a new initiative called the ROSE initiative to detect cervical cancer early. And you can also do the smear yourself. This is using a high vaginal swab. And it's also very effective to detect any HPV infection and early cervical cancer. Colorectal cancer can also be screened, and it is recommended for women to undergo screening, especially those who are for average risk women, then they should undergo screening from age 40 years old onwards. There are a few methods to undergo screening. You can do colonoscopy or sigmoidoscopy. It's like putting a camera in the rectum or into the colon. Or we can also check the presence of blood in the stool. That is called the fecal occult blood test. So it's also recommended to be done. So there are three main types of screening that we should undergo. Mammogram screening for breast cancer, cervical cancer screening with a pap smear, and a colorectal cancer screening. The next type of screening, lung cancer screening using a low-dose CT, is mostly recommended for people at high risk of getting lung cancer. So these are mainly people who are heavy smokers, more than 30 pack years, and also people who are at least 50 years and above. So that's screening. Another way to prevent cancer from happening is to get vaccinated. I guess the main indication to get vaccination to prevent cancer is the HPV vaccination, whereby when we do the HPV vaccination, it reduces the risk of cervical cancer by about 70%. The recommended age for cervical cancer vaccination, for HPV vaccination, is actually up to 26 years old. But even beyond 26 years old, you may benefit from vaccination. You should consult your doctor. And my last point is, for all the women out there, let's try to change our lifestyle. Especially for Malaysians, I think our lifestyle is very sedentary. Our diet is not very healthy. Let's try to make a change. First of all, we try to eat healthy. We look at the picture with the vegetables and salmon. So actually avocado is very delicious, and vegetables, if you make it into a nice salad, can also be very delicious. So try to eat more vegetables and fruits and reduce the fat and the sugar, the santan in our diet. By doing that, we can actually control our BMI, we can reduce our weight, and we can reduce our risk of getting obese. And exercising. If we exercise, you look at the picture of the cyclist there. You can also do Zumba, you can go jogging, even brisk walking is also very useful. Try to target 10,000 steps a day. And try to stop smoking, reduce our alcohol intake, or don't take alcohol at all. By doing all this, actually, we can be much healthier. We don't just reduce our risk of getting cancer, but we also reduce our risk of getting other types of diseases like heart diseases, hypertension, diabetes, and all that. So overall, it benefits everybody. So let's try to move towards a more healthy lifestyle. Get vaccinated, know the signs and symptoms, as I mentioned just now, know your risk, and go for medical checkup. Choose to challenge yourself. This is the theme for the International Women Day 2021. And individually, we are all responsible for our own thoughts and actions all day, every day. Be responsible for your own health and your own body, and do something to reduce your risk of getting cancer. Take care, everybody. Bye. So we have a few questions here. Okay, the first one is, boleh doktor terangkan lebih lanjut berkaitan bagaimana prolonged use of contraceptive pill more than 10 years can lead to cervical cancer? Actually, directly, we don't really know why taking contraceptive pill more than 10 years can lead to cervical cancer. But it was shown in the statistics that it is related. So it could be because of something with increased HPV exposure as well. So I'm afraid I tak boleh nak jawab directly macam mana contraceptive pill boleh menyebabkan cervical cancer, but I suspect it's related to HPV infection. Maybe more prolonged sexual activity, increase the exposure to HPV virus. Okay, next question. Assalamualaikum. Okay. Ibu kepada isteri saya meninggal sebab breast cancer. Adalah isteri saya berisiko tinggi untuk menghidap kanser sama. Betul. So seperti yang saya ceritakan tadi, jika kita ada keluarga yang menghidapi breast cancer, memang risiko isteri adalah anak kepada pesakit, memang berisiko lebih tinggi untuk menghidap kanser sama. Jika kita membuat genetic testing, mungkin kita lebih tahu berapa tinggi risiko itu. Bagaimanapun jika kita tidak membuat genetic testing, isteri encik mungkin lebih bagus untuk membuat mammogram sebaik saja berumur 40 tahun dan membuat mammogram setiap 2 tahun. Lepas itu. Next question. Hai doktor, jika pesakit dah discharge dan dah free cancer, kanser itu boleh recurrent balik? I think yang main problem dengan kanser ialah kita tak tahu sama ada penyakit itu betul-betul takkan berulang kembali. So, kita tak boleh kata 100% tak akan berulang balik. Walaupun kebiasaannya kita kata selepas 5 tahun jika free of cancer, insyaAllah sudah sembuh, tapi kita tak tahu apa yang akan berlaku di masa hadapan. Even sebagai doktor, kita berdoa yang penyakit itu tidak akan datang balik, walaupun bagaimanapun ada risiko kecil yang sentiasa ada, yang penyakit itu mungkin boleh berulang juga. Kalau dah ambil HPV vaksin, still kena buat pap smear test ke? Ya, still kena buat pap smear test juga untuk detect kalau ada apa-apa perubahan. Masih kena buat. Next one. Some theories suggest some superfood can prevent cancer. What's your opinion on this? Superfood tu maksudnya apa? I'm not sure. I don't think there's any superfood lah yang boleh prevent cancer. I think macam saya ceritakan tadi, it's more on environment, lifestyle, and some things that we cannot control. But I think food untuk prevent cancer, I don't think it exists. Yeah. Next question, can breast cancer affect breastfeeding? So most of the time kalau pesakit sudah diagnose breast cancer dan perlu menjalani rawatan untuk kanser, kita tak galakkan breastfeeding. Dan kebiasaannya operation telah dibuat dan mungkin fungsi payudara itu untuk breastfeeding mungkin terjejas juga. Tetapi sekiranya kanser itu sudah lama, lebih daripada 5 tahun dan pesakit mengandung, boleh berbincang dengan doktor sama ada boleh breastfeeding ataupun tak. ada tak alternatif kepada mammogram? Isteri saya nak buat breast cancer check-up tapi takut nak buat mammogram. So actually mammogram adalah antara test yang paling utama untuk detect kanser awal. Tes-tes lain seperti ultrasound tidak sebagus mammogram kerana mammogram boleh detect perubahan yang kita panggil microcalcification, itu lebih baik. Jadi sebenarnya mammogram tu tak sakit pun. Dia mungkin kurang selesa sedikit, dia macam buat x-ray kepada payudara, kita perlu menekan payudara itu sedikit dan sekejap sahaja. Jadi jangan takut untuk buat mammogram. Ianya boleh menyelamatkan nyawa. Okay, I think that's all for the questions for today. Terima kasih kerana sudi bersama dengan saya pada hari ini. Thank you to all who have participated in this session today. Don't forget to share the video so that others will benefit from it. Thank you.